taping to promote scapular retraction here. I'm going to spray with some of this cold stuff. Close your eyes and turn your head away. I'm going to give this just a second or two to dry. We're going to use 2 pieces of kinesio tape on each side. The non-split end will be our initial anchor point. I'm going to have you sit up tall in that chair off the back of it and scoot out to the front a little bit so that I get to the back of you a little bit. So scoot your, there you go. Now up nice and tall, shoulder blades back. So I'm going to put the first piece of tape on the front here. And no tension where you first tack it down. Then I'm going to let this tape split. Okay, just going to keep it there just so it's out of my way. Keep your shoulder blades back. Go along the infraspinatus muscle. And then a little bit closer to the supraspinatus muscle, but not crossing the border of the scapula. And you notice I had some stretch in the tape, but I never put stretch at the end of the tape, either on this end or this end. So that's more for the scapular region. With this particular tape, I'm going to stay off of the scapula, inhibit the upper trapezius, and go down into the rhomboid area here. So I'm going to tack it on front, kind of pec major area. Again, no tension in that tape. When you split the tape, you get a little stronger anchor points. I try not to cross the tape. I try not to go up on the neck too much because this spot will irritate and chafe. And we make sure that the patient knows that they can take this off at any time if it starts to irritate their skin or if it starts burning or itching underneath. Occasionally you will have redness underneath the tape. Warn the patient that that is a potential side effect of the tape. And again, to take it off if they feel any irritation at all. Otherwise, to try to leave it on for 2 to 3 days. Sometimes the first time I've taped them, I'll tell them only 24 hours, just so that we don't leave it on too long. It'll curl up on the edges just a little bit, but it should remain intact even through showering and that type of thing for 2 to 3 days eventually. Make sure that there's no oils on the skin, any massage lotion, any remnant of that at all will make the tape not stick. So we've just done the right side, we're going to do the same thing to the left side.